Being Fayette County Commissioners order, we'll start with pledge allegiance to the flag.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You all have a copy of the minutes of preceding meetings. Is there any additions or corrections?
Mr. President, if there are no additions or corrections, I move to accept the minutes as presented.
Second.
Been moved and seconded, minutes be approved as presented. All in favor say aye.
Aye.
Opposed? Motion carried. Start with department head reports. Mr. Havlin, Highway Department.
Good morning.
Morning.
We've been ditching and berming up and around Bentonville area up in there, doing some gravel roads. We've done some tree trimming. We've got them shut down today because we're getting trucks ready for what's coming, because there's supposed to be snow by Thursday afternoon, I think is what they're yelling for. And I'd rather they do it when it's not raining than try to put them all together outside in the rain.
Right.
Because I don't need a bunch of people sick and then go in that kind of weather. I wanted to let you know that I've got one mowing tractor. We're going to mow trees or bushes, roadsides next year. It's going to have to replace it because it's got something going out in the rear end in it. As you drive it down the road, it's the one we've had over
Is
there
that the
4 or
one
5
we had down
times.
to Zimmers? And
No, this is the International from over there, Rushville. The little one we've had over there on different problems with it, and as more you use it, it starts binding up in the rear end on it and starts slowing down. And it's something we're gonna have to look at next year.
how big a
Something like-
tractor is that, Jay?
It's a 4210 International,
Okay.
the small one. It really needs to be a little bigger for what we use it for. We just work it too hard.
How many horses is that?
100 horse, because you have to have that for the mower and everything on the back of it.
Okay.
But that's something we'll have to look into next year before we start mowing. If we're gonna mow the roadsides, we're gonna need it, because the 90 Ford we've got, I don't think it'll stay together for the whole year. 'Cause
Right.
it's getting a little age on it. But that's mainly all I have.
Okay. Thanks, Jay.
Thanks, sir.
Okay.
Bill Gray.
Morning, gentlemen.
Morning.
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 I've got some calls out on that, bids on replacing those boilers, low water shut-offs, and nobody's got back with me yet. I even called out some more this morning, so I'm still waiting.
It's hard for me to understand why everybody's wanting work, and then when
I know.
we
Nobody will
need
get back.
somebody, we
I'll
can't
stay on
get
that
one.
this morning to see if I can get at least one more back.
Right.
And on our service contract for Johnson Controls, same thing there. I got emails out to companies out of Indy to try to get a bid. Today, this morning, I'm gonna send out some service equipment list and see if I can get something that way. I'm not getting any response to the email for anything, so if I send out some equipment sheets and where they can see what they've got, maybe they'll do that without coming down and giving us it'll have all the equipment.
Okay.
So that's where I'm at on that.
Okay.
Other than that, I don't have anything else, other than I got some outside lights that need to be taken care of today before it starts snowing.
How much snow are they predicting?
I'm sorry?
Are they predicting a lot of snow?
I think there's more ice and sleet stuff is what they're saying right now.
Okay.
Okay.
Thank you, sir.
Bill. IT Director Ben is busy fixing the problem right now. I did talk to him before the meeting. Our cameras are about 90% installed and operational. They'll be completed in the next few days. Council representative, do we have one?
Shirley.
Shirley?
Nothing new.
Nothing?
since last meeting.
County Attorney, Chris?
Yes, I just prepared the ordinance to establish the council districts. It's waiting for your guys' signature, then we'll file it with the clerk of the circuit court after today. So you guys can sign that now or wait till the end.
Well, we need to pass a motion to approve that, right?
Yes,
Yeah.
yeah.
All right.
Well, basically, it's moving all of the precinct Connersville 9 from District 4 to District 1, and all the precinct of Harrison 1 moves from District 3 to District 2. So all the 4 council districts are as close as possible within the
We're
10%.
in compliance as much as we can get then with that, right?
7.5% the statute requires within 10%.
Okay. Okay. and this is kind of Melinda's recommendation of how to do it right.
Yes, that's correct.
I would entertain a motion that we go ahead and pass that and get our council districts in line.
So moved.
Second.
Been moved and second, we approve the redistricting the council districts. All in favor, say aye.
Aye.
Opposed? Motion carried. You have anything else, Chris?
No, not at this time.
Okay, all right. We have any mail?
No. Did you put anything in the box on?
No. We'll go on to old business. First item is the health insurance. Our health insurance is due to be renewed the 1st of January. Debbie and I have been acting as a committee to look over different health plans and get the best health insurance we can in the money we've got to spend. We do have a recommendation for the other two commissioners, and at this time I'll let Debbie go over what we've come up with.
Okay. We received information, we received actually some proposals from Nippon for renewal of our current plan, plus they offered two different alternative plans that would increase deductibles and thus lower rates. We received an Anthem quote from Karen Lippincott here in town, and we have on page 2 on her quote, she's quoted really close to the current plan, be pretty much identical to the current plan. Plus she quoted a $500/$1,500 deductible, and she also quoted a higher deductible, but what they're proposing for a health savings account, which would be funded by the county. We also received a United Healthcare quote and an Anthem quote from Tobias Insurance Group. I put the United Healthcare quotes down here because the Anthem quotes are identical. So either one of the Anthem, all the Anthem quotes would be the same for the Tobias. We did receive quotes from two other companies, Nice Lukens and Consolidated Union. They both funded they both quoted a partially funded plan. And if you would look at the minimum the county would have to pay on either one of those, it looks good. However, the problem being with those is you have so much fluctuation in what you would have to pay. Then on closer look, we would have to pay after we would pay our premiums, we would pay until we got to the max, and from January to December, and then after December, for those months, then we'd have to pick up what they call runoff claims, I think is what they call it. So the county had been in a partially self-funded plan in the past, and pretty much we just did not know that we wanted to get, I don't know, I was a little afraid of that plan for
We
fear
really
of
just
not
don't
being
have the
able
money to gamble
to
on.
contain cost, yeah. So what I have passed out to you is, the first page has Nippon's rates for their current plan, an alternate plan, which is $500 deductible for an individual, maximum of $1,000 for a family. It would change the doctor copay, $20 for your what do I want to call it? Your regular doctor for your and then $40 for a specialist, and then the prescription rates would remain the same. And then pretty much up at the top the same way, they've also quoted an alternate $1,000 deductible individual, $2,000 per family. The 20/40 doctor copay, and then the prescription would be the same. These plans, and I've left this first column on each of these sheets shows what we're paying this year. So in comparing those, to renew at on the current plan would be a 22.9% increase over our current plan. If we went with the higher deductible plan, it would be a 19.3% increase. Bringing either one of those, and then the alternative plan, I missed getting the formula copied over, but you could see what the difference would be from our current plan. Then when you go to the next page, I've showed the Anthem plan presented by Karen Lippincott. The current, if we quoted the Anthem that's similar to our current plan, it would be a 21.16% increase. They started out way higher and then came back with some additional, they discounted it more. The shaded, that middle plan, that's a $500 deductible per person, $1,500 per family. And that's a $25 across the board doctor copay. It bumps the prescription cost up, $10 for generic, $30 for name brand, and then a $64, I think, non-formulary. Anyway, most people would pay between the $10, the $30 copay. That is a 4.97% increase over our current plan. And then the option here for an health savings account, and how that one would work pretty much. You can see there's pretty deep reductions here for going with this plan. It's a $1,500 deductible per family, per person, $3,000 per family. And then everything else is subject to the deductible, your prescriptions and everything. And then that would come in, it actually would reduce the cost by 11.25% over our current plan, but it would enable the county then to take and fund, the county would fund the HSA to the tune of $1,000 for an individual and $1,500 for family. So that would mean we would be adding, see we've added back in to bring that cost to a total right here of $1,685,427.73. The one thing that we have thought about, which I am kind of concerned because everything goes against a deductible. So I am kind of concerned, and I don't even know how many employees would be impacted, but the employees that had a prescription plan, they would, if they had prescription drugs, about them being able to do that, because all of their deductible would be due probably, I mean, their portion of their deductible would be due when they went to get their medications, and it would make it not quite as, you have pretty much fixed, you know what you're going to spend on your monthly expenses, what's going to come out of your pay for your health insurance, and then you might have that bump and not be able to pay it for your prescription drugs. The last page has the Tobias United Healthcare. That one runs really close to the Anthem plan, and they're within a couple $1,000s of one another for the United Healthcare. Then they also offer an HSA plan. It would be a reduction, but then we'd have to add in, if we added in the $145,500 for the county funding of the health savings account. That really would almost bring you right back up to what what the other plan would be. They really, for their health savings account, they did not offer as deep a no, I don't want to say discounts, but a reduction in premiums as Anthem did. I think after looking at all of these, I think it would probably be maybe appropriate to go with a combination of a traditional type plan along with a health savings account plan, and then let the employee decide. And then as they get better educated in the health savings, you're going to have some people that don't use their insurance very often, that the health savings plan would be very attractive for them, because then that money's they could use those monies for other things, dental or doctor or anything that was medically related. Did I explain?
Explained it very well, I think. And one of the thoughts about offering both plans, the cost of insurance continues to go up, and the funds the county has to pay for it remains the same or goes down. So we're probably going to have to go to something like the health savings plan in another year. This will ease it in, because the way our funds are going, we probably can't offer that first plan another year if the insurance continues to rise. Does anybody have any questions of? I will say, Debbie and I have spent a ton of time on this. We've talked to several different insurance people. All were very professional, but it just comes down to what we can afford to keep the insurance level about where it is now for the employees.
Mr. President, I appreciate the time you and Debbie have committed to this, because I know it's been a lot of days and a lot of numbers going through your heads and considerations and judgments, so I do appreciate that.
I do appreciate it as well. I want to say thank you to both of you. This is not easy. The decisions have to be made, and for the best of the ability to the employees of Fayette County, we needed to keep the costs as low as possible, because to be fair to them. So it's an all-around fit. So thank you guys for all your work on this, Debbie and Bart both.
I might add one other thing too, and that's kind of what we didn't, when you said, how much we can afford and all things. We have roughly $1.5 million and change in the county's budget. The county's portion, the county pays 85% of the premium, and the employee pays 15% through their payroll deductions. And we have about $1.5 million in all of in the different insurance line items. We've kind of taken the highway out of this, because they now have went on their own plan through the union. But if you kind of look, and I've broken that down, what the county's costs are, and you can see what we can afford, and really what we can't afford by what portion the county's is of each of these. So I think I am missing a total there on that Tobias United Healthcare, which I could get pretty quick if you needed that. So.
And we are still, we have been talking all year long about finding some way where we could fund the over 65 people that we have employed, fund their supplement plan, instead of them being on this, which would save us $8,000 or $9,000 a year, and they would have as good or better insurance than they have now. We haven't exactly come up with a way to do that, but because you have to treat everybody the same. But if we can find some way to do that, that would save another $50,000 or so.
Are you ready for a motion, Mr. President?
If there's no other questions, I'd entertain a motion to approve the recommendation.
I move we accept the Lippincott plans from Anthem, both the health savings account and the traditional one where the, correct me if I'm wrong, David, it's 500, 1,500, correct?
Yes.
Yeah.
Second.
Been moved and second, we accept the Lippincott, two plans of the anthem. If there's no other questions, any more discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. The next item on the agenda, which has been mentioned before, that the land down in front of the highway garage is a possible site to build a new garage building we want to build. Chris tells me that we need a resolution of our intentions to negotiate for that, and that doesn't mean we'd go ahead and buy it. It would come back, but we would give a negotiated price on that, and also allow us to hire two appraisers to go down and look at it. If the county buys that property, you have to have two appraisers and not pay more than the average of two, if I'm correct.
Yes, that's correct.
So if the other two agree with that, I'd like to have that motion so we can proceed with seeing what that land would cost.
So moved.
Second.
Been moved and second that the county, that we negotiate with the owner of the land to see what we can get the land bought for. It's about 3 acres down in front of the garage, and that we go ahead and hire two appraisers to see what that land is worth. All in favor, say aye.
Aye.
Opposed? Motion carried. Thank you. New business. Is Steve Godsey here?
Oh, is he outside?
Just now walked out into the hallway.
Would Jay want to step out in time if he does want to speak to the
Here he comes.
commissioners?
He's coming in now. Steve,
Mr. Godsey?
we're just getting to you. You ready?
Yeah.
Would you step up there, please?
They told me I didn't have to be, this would be the very end of the meeting.
Sorry.
I thought I'd come early.
What did you wish to speak to us about, Mr. Godsey?
Out there where I live on 150 East, we've had water problems out there ever since we lived out there. They came through a couple years ago, burned the ditch down on the east side of the road a couple times. Didn't get it deep enough because there's about 5 trees in the way. Plus, we've got 2 culverts that drain Jeff Jones's field across the road, plus all the way down from where Mrs. Bunyard lives on 150 down by 100 North. All the water comes that way, hits our culverts, and instead of going down to the $1 million bridge down the road from us, we got a $10,000 pond west of our house that's a foot deep because they will not divert the water down the ditch because the trees are there. Jerry Gobin 2 years ago.
Well, Steve, let me answer part of your question. At the last meeting that was discussed, I understand that they have come out and dug some of that
Right.
ditch out.
Okay.
Now, as far as the trees are concerned, that is on somebody else's property. They have given us permission to remove them.
Yes, they have.
Okay.
Yeah.
The fact of the matter is, we don't have, that is a project that we would require a contractor to come in
Right.
and take them out.
Right.
We authorized the last meeting that we do that, but as far as, because of budgetary concerns, that's gonna have to be after the first of the year.
Okay. I have a couple more points I want to make. When they came out there last week, I don't remember the guy's name running the grade all, but he did a fabulous job, you know, cutting them down on both sides of the road, okay? The main problem with that was the water couldn't get off the road, and we've got $1,000 worth of tile work in our front yard that the water was coming from the road into our front yard and then run into our basement. So we had to have, we got, I don't know, at least 300 feet of tile on our front yard that's covered with 18 inches of gravel trying to keep the water out of our basement. I would say what they did last week fixed that problem.
Good.
But the deal with the pond is those culverts shouldn't have been put there knowing that there was a bridge just a quarter of a mile down the road, and the water only had to get past it. Well, you know how it is. That barn we got out there, as soon as you get past our new barn there on the north side of our house, it's all downhill and water's going to find its way. My problem is, right now, you fixed the problem where the water is going to be in our yard, but when it rains with those culverts, it's not deep enough. I mean,
The ditch is not deep enough?
it's not deep. It got rid of the surface water. It's going to get rid of the surface water on the road, but as far as it's going to have to be ditched deeper to our barn where gravity can pick it up, but they burned it all the way. They started, well, in fact, they did 150 east all the way from Springersville Road to 150 north on both sides of the road, except for a couple of property owners said, "Don't you dare cut my grass off," which I would have done anyway. But that ditch is going to have to be dug deeper to where those culverts can be closed off and have the water go that way instead of just. Well, I've had to have the ditch rearranged on our property one time already from erosion, and I brought in probably 10 or 20 tons of any type of construction waste, cement block, concrete, rocks, anything, just to keep it from eroding that ditch out deeper. Because when it starts going downhill towards our pond, some places down there that ditch is 4 feet deep, but we got a 30-inch culvert on the south end of our property line, and then we got I think it's a 15 about halfway up towards the house, and the water just pours out of Jeff's Fields and down 150 from, like I say, from Mrs. Bunyard, but unless those culverts are closed off to where that water, can go straight past our house and hit that new bridge down there, the problem ain't gonna it's not gonna be fixed. Because I know Gobin said something to me, he says, we didn't put them culverts in there. I said, I know you didn't put them culverts in there, Jerry, but you guys are kind of responsible for what previous work was done, by Fayette County. I said, because the city of Connersville or the state didn't come out here, and say, well, we're gonna, put this culvert in here because it's a quick way to get the water to the river. So.
We are going to address the problem the first of next year, right?
Okay.
Right. Isn't that what we
trees,
decided
yeah.
we were going to
Well,
do?
I've got-
trees, we have.
The culverts have been there for as long as I've been down there, over 30 years, they've always been there.
Yeah, I know.
It's a natural flow of the water going that way.
Right.
To stop it, if you dig a deep ditch there, coming out of that field, it's still gonna jump the ditch. If you've got that much water, there's no way you're gonna get it to turn. You know how water works. When it's coming out of the field, coming out with that much force, it's gonna jump onto the road.
Right.
I don't know how deep a ditch you can put in there to really stop it. It's a bad situation. But I remember when they replaced the one culvert by your house, it was because the other one was collapsed.
It was collapsed, and us,
So by
Side
you,
L got it.
by you putting the stuff in the culvert, like you said, was your option to try to slow the water down?
Well, the stuff's not in the culvert, it's outside of the culvert, on our property, and you have to try to slow it down so it wouldn't do so much erosion, so it would hit it, and spread out.
I mean, the end of the year, budgets are tight.
I know
And
they
so
are.
when it rolls around at the first year, then that's when we start.
Okay,
And they said they would get to
We'll
it.
work on the trees.
but I told Jerry that I got some white paint, I marked those 5 trees that needed to be removed, and, that's what they were gonna remove 2 years ago, and that just kinda, I knew something was going on when he kept saying, yeah, we're coming, and I said, I'll call you as soon as the crops are down, we'll come out and do it. And then it went on, and it got to the end of December.
You
Don't
talking
have
about
no
this
money.
year?
Don't have no money.
Are you talking about this year?
No, 2 years ago.
Okay.
2 years ago when Gobin was
Well,
going,
I don't know, it very well could be the same situation.
when he's gonna
we
have John
down here.
Frank's crew come out there and, you know, and like Jeff Jones, the property owner, he said, cut them down, let them lay in the field. James Jenkins will cut them up for firewood, and all you guys gotta do is just haul a stump away.
Well, like I said, that's fine if we can get the permission to do it, but we also have to have the money to do it, Steve.
Right,
And the first
right.
year we will have, and we addressed that last meeting.
Okay.
Okay.
I just wanted to say what I needed to say, I
That's fine.
guess.
We appreciate it.
Okay.
Thanks, man.
Thank you very much,
Thank you.
guys. Thanks, Jay. Did a good job out the ditching there. A lot better than last time they did it. Because they just barely
This
cut the
thing's great.
grass open. Now it's got a good
This thing
flow
great.
to it, so.
Girls took care of
Thank
it.
you.
Thanks.
Next item on the agenda, I have no idea what we're talking about. It says Fuji Treatment
It's-
System.
I think that's him.
Yeah, my son, I think, called and said, we're a water treatment company out of Indianapolis.
Uh-huh.
And I can give you all,
Thank you.
Thanks, sir.
this'll not take long. Stand up here so we can just talk, or do you want me to sit down?
Stand up
Actually,
there,
that-
put if you would there, and
You're on
everybody can see
camera
you.
and
Makes it
everybody,
easier for
everybody
the
can
camera.
see you that way.
Great. I'm Bill Freegee. I think my card is in the
Yes.
thing. I'm with Freegee Treatment Systems. A lot of people know us as Easy Water. You've maybe seen our residential commercials. You can see our building, we're headquartered right across from Mount Comfort Airport. If you've ever been to, you know where Mount Comfort is there, north of 40. And we've been in business since '86. You can see that on page 3. I'm here because we are known, I hate to say this, but we're known nationally. We're kind of the national leaders in what's called no salt water conditioning. It takes the place of a salt type softener. We do a lot of work nationally for companies like Frito-Lay. You know, if you go up to Frankfurt, you'll see a bunch of our systems in there. And Motel 6, if you stay in a Motel 6, when they refresh one of their motels, they put one of our systems in to keep scale from forming, and then they don't have to use a salt type softener. Some of our equipment there is on page 4, but the system that we have been supplying to some of the county jails, we do a lot of work nationally with a lot of companies that you would be familiar with, but about 9 months ago, an engineering firm, Energy Systems Group, specified us to be installed at the Shelby County Jail. And they came in and did an energy audit and said, change these light bulbs, do this, and put this Easy Water system in. It'll remove the scale from your water heater, and then you'll save energy. Well, they did that. They loved it. In fact, Sheriff Bowlby invited us in 2.5 months after it was installed and showed us where we had removed the scale from their pipes. Now, they had had a water softener for 20 years. They had just put in a new Culligan softener about less than a year prior to that. But a softener, a salt softener, will slow down scale buildup. It won't eliminate it. Our system will actually go in and remove existing scale. It's a physical treatment. If you go to page 7, you can kind of see just roughly how the thing's installed. A box hangs on a wall. We treat the main cold water pipe, which in your jail is probably a 3 or 4 inch copper line. And I don't know if you heat water, and I'm sorry I didn't get your name. Bill, okay, I'm Bill also. Bill, do you heat water with a boiler storage tank or with tank type water heaters, or do you? Okay, with a boiler storage tank? Okay. So, and do you have a salt type softener now? Pardon?
It's a salt.
Oh, you have something that's a no salt conditioner? Okay, I didn't realize that.
When we redid the jail, we put in at that time.
Okay. Is it working well for you? That's great. Whose is it?
I don't know. It's been done through
Because it could be our system. I don't really know.
It was
Yeah,
done through the service contract, right? Redid the plumbing and stuff.
yeah, it could be, well, that's what I was here for. I didn't realize that you had a
We
system.
also have it here in the courthouse.
Do you? Okay. Well, anyway, that's why I was here, because we've done quite a few other jails now. And we just wanted to survey the jail and quote the system. But if you already have it and it's working well, then there's really no need to do that. So,
Okay, thank you.
all right.
Thank you.
Thank you, sir.
Next item is Everton Sewer Board appointment. Do we have anybody to speak to that?
Well, I can, only because my husband's on the sewer district board, and he didn't feel well enough to come today. Judy Flum, who is a board member, but is also their secretary that records and processes all their, the district's sewer liens. She is retiring from the board, and they have someone they want to put in that place that can, and as a board member that can also serve as their board secretary, and that is Mandy Wolf. She lives in Everton area, and she works at the bank down in Everton, and they would like to have approval to appoint Mandy to the board.
I certainly have no problem with it.
Mr. President, I would move to appoint Mandy Wolf to the Everton seat that's available.
Second.
Been moved and seconded to appoint Mandy Wolf to the Everton Sewer Board. Is there anybody have any comments or questions? If not, all in favor say aye.
Aye.
Opposed? Motion carried. Community sharing. Zane, you asked for this item to be put on the agenda. You want to speak to that?
Would you give us your name, sir, please?
David Gettinger.
Thank you, sir.
Hello, Mr. Gettinger. The reason I called you here is, or sent the letter over to you, is I had received a phone call from my wife. I guess you would talk to her, and said that if I wanted to come over and ride the elevators, you'd be there from 1:30 to 3. The reason why we brought you here today is because Mr. Gray is here. I realize the elevators are old, and the service of them, you know, they can break fairly easy. The argument is that a couple of months ago, we had an issue where the elevator broke, and this bolt was snapped completely in half off the elevator, costing the taxpayers of Fayette County right at $3,000 to have replaced. So the other, I think we had talked, and we had talked, and I said, well, let's make sure we don't, nothing happens to the elevator. And again, it broke again, and it was right at $3,000. It come right down to it where we had to say we can't keep telling the taxpayers of Fayette County that they've got to keep paying for the elevator to be fixed. And the elevator is in a lot of use, whether you put food on it and transport it up and down, or people use it to go up and down. It's getting a lot more use, and it's costing a lot of money. So, as my position as a county commissioner, and I can't speak for the other two, we just couldn't keep passing the cost off. So, instead of just looking at the community sharing and saying, you know, because there is a need for community sharing, and saying, well, you know what, you guys got to move out. I've done a lot of work over the last couple of weeks. And there's a gentleman here to speak. He's back there in the corner from the Salvation Army. The Salvation Army has said they would be more than happy to accommodate community sharing at their facility. The other part of that is, the other commissioners and I had discussed, a way to not, because that's a lot of equipment. You have refrigerators, you have other stuff. The other suggestion has been made to use Department of Corrections to move to the Salvation Army. And if you'd like, I'd like the gentleman from the Salvation Army to come forward and explain what their offer is on the
Could
table.
I intercede?
Sure.
Nothing has been discussed with me about the use of the elevator. I certainly would propose that we not use the elevator, if that would keep us in our present location, because we love that location. It's so much better than what the county provided for us before over in the H&K building. It's secure, it has plenty of room for us, it's perfect for us, and we would just terribly hate to have to move our 7 refrigerators and freezers and give up our location, but we would certainly, and we have done it in the last 2 months because of the elevator being down, of getting our food in there and out of there without the use of the elevator. It might not be good for the public, but if that would solve the situation, I think I could speak for the people I brought with me, Howard Campbell, our historian, and David Hayes, one of our loyal volunteers. I think you would agree with that, would you not? If that's the way it has to be. We don't feel that we've tried to treat the elevator with respect and be a good citizen, and we think that the amount of weight that we put on there is not anywhere near close to the prescribed limit. David Hayes, you want to speak to that a minute?
Yes. I understand the weight limit on the elevator is listed at 2,500 pounds.
Yeah.
We have 2 carts that we put one at a time on the elevator with a person, and the maximum we can load on those is about 500 pounds on the cart of canned goods, and one 200-pound person for 700 pounds. I don't see how that is anywhere near the load limit of a 2,500-pound rated elevator. So I don't think we're overloading it at all. And as for the number of trips that it takes, maybe 10 trips up and down to once a month is what we carry. And most of our patrons don't use the elevator. So we're only talking 10 trips for community sharing in a month.
I have a question real quick.
I wonder about wearing it out.
Are you guys through Gleaners Food Bank? Do you go through Gleaners?
Yes.
Okay. The Salvation Army is through Gleaners. So there's 2 entities within less than 2 blocks from each other that are doing the exact same thing. And if it's the same entity, it should be together. That way, it works out for the better purpose of the community, and especially in that area, in that location where the Salvation Army is.
Well, I'm willing to listen, but
All the people that are involved with community sharing are still going to be doing the same thing they're doing right now. Nobody's going to get booted and say you can't help, because the Salvation Army they're in dire need of help. They can't get enough of it. And people need to be fed. I'm not saying that it's the holidays, people have issues, elderly people, they live on a fixed income, they can only afford so much, and I understand that. I'm not here saying, hey, I'm against giving away food. What I'm saying is that building is getting old, and it's having a lot of problems. And at the end of the day, we've got to start looking at cost savings down the road as far as the taxpayers are concerned. It's not it's not a personal thing, it's just, we've got to stop spending money we can't spend. I mean, you heard us this morning with the insurance deal, we just don't have it. And when a bill comes in, and I understand you say, you know, we're not going to use the elevator, you know, that building takes a lot of traffic. When are you open? Mondays? Mondays and?
Monday, Wednesday, Friday, 1 to 3.
Monday, Wednesday, Friday, 1 to 3. Salvation Army only has enough volunteers to keep their food bank open 1 day a week. Well, if you guys, and the county is going to help you acclimate into that facility. We're going to take all the burden and take you to that facility. All you have to do is show up and keep doing what you were doing as a volunteer. It's a win-win for you. It's in that neighborhood. It's not that we're trying to get rid of you. It's we're trying to find ways to cut to get the cost down for the taxpayers because we just don't have the money to keep doing things. And I wanted him to, the gentleman back there, I forgot his name, to speak on behalf of what the Salvation Army is offering community sharing as the Gleaners Food Bank. So,
I'd be glad to hear it.
okay.
Thank you, sir.
Well, good morning, council. I appreciate the opportunity. When we were approached to, I'm sorry, Alex Norton.
Alex Norton.
Alex Norton, apologize. When we were approached to help out, I mean, we're only coming here as a community partner. We're not trying to sometimes rob territory, take territory. We're just here to help out. We have a facility just down the street that we use right now for a pantry program. And probably within the next year, we're going to be expanding because we have to expand our soup kitchen. So there will be some things that will be changing with our facility as right now as far as the foot space is concerned. But what we are offering and proposing is that we currently serve Tuesdays and Thursdays, but we have Mondays, Wednesdays, and Fridays open, which I understand that's when they serve. What we want to do is bring this group under our umbrella of the Salvation Army and to offer them the opportunity to serve the same days they're doing, just in a different location, working with us as a partner to serve the community here. We would basically still be working under the same guidelines as Gleaners like they do right now. There are some other logistics that are changing because we do work with other providers besides Gleaners. But I think it'd be a great partnership, and we're pretty easy to work with. You know, we don't cause too many problems, and we just really want to help the community.
And you and your wife are the ones that are that run the Salvation Army and such. And the other thing I forgot to say is it is the holidays. It's Christmas, Thanksgiving just passed. We're going to wait till after the first of the year to even do this, if we're going to do it. So you'll still be able to go through Christmas, pass out food, you know, because I don't want to interrupt the holidays. This is when people need you the most. So let's just wait till after the first of the year. And if it's Gleaners and Gleaners, Gleaners should be together. And with your facility, it's a ground floor facility over on, what's 5th Street?
Yeah, southwest over there,
Okay.
yeah.
And is the Lord's Kitchen over there?
Yes,
Okay.
that's
So
our other facility that's right across the street, yeah.
It's all right there together. And it kind of, I think it's a perfect fit. And it's, I'm not going to point blame at anybody. I'm not going to worry about, I just think it's a good fit for you, and it's a good fit for the county, and I think we should entertain the idea to do it and not do it, and do it after the first of the year.
And I just to make the council understand, there's no agenda here. We're not trying to gain, you know, more operating status within the county. We just really want to help out another agency that needs help. And it's really what we come here for with our full intentions.
You're feeding the hungry.
Yeah.
It's not about control. It's
Right.
about helping people in need.
And I just want to make sure everyone understands that's not our intent whatsoever.
Thank you, sir.
Thanks, sir.
Appreciate it. Mr. Gator?
Mr. Gator, you know, it would appear that this was a win-win situation for everybody. Do you agree with that?
No, not at this time completely. There are many, many questions that come up. I think before anything is done at this meeting, we, as a committee, would need to meet with the Salvation Army people and see if some of the problems could be addressed that we see coming down the road.
Such as?
You want to speak to that, Howard?
Well, there's a lot of questions that we'd have to, if we would entertain this, we would have to ask about our facilities, about the money, the donations and all that, that'd be a big move to make. So it's something that, like the councilman said, we've got till after the first year, probably we could maybe do that between now and the first year, meet with the Salvation Army and see what they have to offer. But it's something you can't make this season right now,
Space is a concern. As I said, we have 7 refrigerators and freezers, and we need every one of them from the amount of food that we get in.
I understood that he thought he had room for that, And this...
Does he have electrical supply for all of them?
You can ask him, I would assume so.
Yeah, we would. If we needed to, we would expand as well.
And if that location, it would seem that it's just right around the corner from where we are, so the location would be as good as what you have. If you could find another location, that would, we certainly...
Well, we certainly don't know of any other location that's been addressed before at this body, and we feel that we are in a really secure location and don't have to ever worry about getting broken into.
You understand our problem with maintaining that building, we just don't have the funds to... It would seem that if you was on the ground floor somewhere, it would be a lot easier for you and your clients you have coming getting that and everything, would it not?
Are you anticipating closing that annex building altogether down the road?
That's not something we're gonna discuss today. We don't know yet. Debbie, our next meeting is on the 17th, correct?
Yeah. I have to do math. 3 plus 14.
We can table it till the 17th, but we have to do something. So it would give you a chance to talk to them. It's not about, I know you guys do a good thing. We know you do, okay? We see the outpouring of people who come and see you every week. It's just that come across my lap as the Salvation Army, and it was a perfect fit. And I thought, well, why can't we do this? But I can understand you want time to ask questions. So I say we table it for now till the 17th, but we're going to have to make a decision on the 17th.
Why don't we do this the first meeting in January?
Okay.
That'll give you plenty of time.
I was going to say, we have a truck coming in usually the 4th Tuesday of the month, and last month we got almost 6,000 pounds of food in that truck from Indianapolis.
Well, if we make a decision the 1st of January, that don't mean you're going to be moving the 2nd.
Right.
But if you do move, we'll have the people to handle the move for you. That won't be a problem.
I see.
Go ahead.
I guess I'd ask the Salvation Army, are we being offered a place to go, but not, our entities will be separate? We'll not go in with the Salvation Army. Salvation Army will not come in with us. We'll still be a separate.
Why don't you and the Salvation Army discuss that, see what problems you have, see if you can work out any problems.
Yeah, because we've been an entity since 1985.
I understand, sir. What I'm saying is, why don't you meet with the Salvation Army, see what you can negotiate
We will
out.
certainly do that.
See if there's another place you would rather go, and then come back the first meeting in January, and we'll hash it all out.
That'll be fine.
Okay?
Yeah.
Okay.
Thank you.
Gentlemen.
Thank you.
Appreciate it.
Next item on the agenda is Matt Shirt, rental ordinance for Health Department.
Does everybody have a copy of the ordinance I gave them? Or you need another copy?
I do. I'll take another copy too.
I didn't bring
Oh,
enough
no.
copies, but.
No,
Oh,
well,
wait, I brought you.
I have the real deal.
Okay. Huh? I have 2 more copies. But I need another copy for.
We'll share one.
I've already seen it. I've read it a couple of times.
Okay. What I've given you, I gave everybody a copy in their box, or the commissioners a copy in their box. It is a an ordinance that I have written based on some other ordinances in other areas for rental housing. What's going on is I do a lot of inspections. Obviously, I do a lot of complaint inspections about poor conditions and stuff like that. And when I go into a home, I have to look for something that is a health hazard for me to enforce any kind of health code to say that this is a direct health hazard, is causing somebody to get sick or something like that. And what I'm doing is I'm going to a lot of these rental houses, and I went into one a couple months ago, and I went in and they had a hole about 3 foot around in the ceiling. And I said, I can't do anything about it. You know, they have to pay their rent and they have to go on, and the house just wasn't structurally sound, and the landlord was still renting it out. So I started checking on a way to control or what kind of house is being rented. So that's why I wrote this ordinance. It basically just says there's minimum standards that need to be met to be able to rent out a house. That's providing a sound structure, you know, good electrical, water and sewer, and some other items on there that you can go through. So that's why I'm presenting the ordinance, to try to get it passed in Fayette County so that we can, and the health department would be the one that would inspect and enforce the ordinance. So just trying to help out the citizens.
Mr. Appel, have you had a copy of this before?
I haven't,
No,
but I can look over it. Is time of the essence for this?
No.
Then I would suggest let him
Right.
open the door.
I apologize. I did
That's fine.
Yeah. I
What's the
apologize.
enforcement on it? I mean, what do you, if this is
It's on
passed?
it's on the back of it says enforcement there, or this.
So this would include every home in Fayette County?
No, this is just for rental homes.
Well,
Something-
excuse me, I meant rental homes inside the city, outside the city?
Right, everything,
Okay.
anything in Fayette County.
Do you mean,
Go ahead.
Matt, do you mean subsidized housing or just
No.
anyone who rents?
Anything that's rented out, yeah.
And I haven't had a chance to look through this, but did you address, or can you address, or is it your right to address smoke alarms and things of that nature?
I did not address smoke alarms. I don't believe that's in the ordinance.
But aren't they're not required in rental housing?
That's always been handled through the fire department, as far as anytime somebody talks about smoke alarms and stuff like that.
Well, the
But
only reason I ask,
Yeah.
or to bring it up, is that since we're talking about an actual ordinance, okay?
Uh-huh.
It would probably bolster the fire department's position
Right.
if it was included in the ordinance.
And it's a good idea, and I haven't thought of it, but
Yeah.
if you could
If you're
easily
going
put
to
it
be
in something.
inspected anyway, you might as well
Yeah.
look at that instead of
And
somebody else having to go in.
I'll be honest with you, I'm a landlord, okay?
Uh-huh.
But we're inspected every year by HUD because
Right.
we have elderly tenants and everything like that, and I think this is something that's long overdue.
Yeah, I mean, the houses that aren't HUD approved or another type of inspection, that's what this would, you know, well, it would apply to HUD houses as well, but this would also address houses that aren't HUD applied, that currently we have no rules for.
HUD probably is stricter than maybe some of this, or,
They have a sheet of stuff that they look for. I'm not sure
Yeah.
exactly what their inspection checklist is, so.
but that doesn't mean it's kept up sometimes too,
Yeah.
if you've
I
had the same
inspect-
person in
I do
there.
complaints on a lot of HUD houses
Yeah.
as well, so. But yeah, it'd be great if you can review that again, and I'll,
We'll do that, and Chris will give us a report the next meeting, and then we'll go
Okay,
ahead and
I'll
act
come
on
back
it
up then.
in that next meeting this month.
all right, but yeah, I think it's very important
Yeah.
to the people that are renting, that there be some kind of standards, so.
I think you're right.
Yeah.
Okay, I have a couple other items. Terry asked me to turn this to you. It's just about our health board. There's a letter from Terry, or Dr. White, actually. We have 2 appointments on the health board, so, that are opening. One's Dr. Metz and one's Hilton Henry. Their both terms are up. Dr. Metz, is that we've asked that you reappoint him.
Are those first of the year
Yeah.
terminations?
Yeah.
Appointments. Okay.
Appointments. Hilton Henry has asked to not be reappointed, so there is an opening on our health board. And the letter addresses that.
And do you have a recommendation for that?
No, not at this time. We don't have a recommendation for Hilton. We just learned last night that he has not to be reappointed.
Okay.
Yeah, if you get that before their meeting, because they typically make those.
Okay.
The other thing, on that, Transact RX, I tried to get a hold of Terry to see about getting that signed. Do we have that? I mean, I don't know if I have that.
I think you
contract.
have that, because that was on my list here that they
Does
asked me to
she,
ask about.
yeah,
We haven't seen it.
do not, I don't think I personally have it. Chris, did you have that Transact RX
I had a
contract?
copy, I didn't bring it. I
Okay,
thought, when we speak over the phone, that's gonna be, I mean, it was
it was,
a
you said
valid
it was
contract.
okay?
Yeah.
So
Okay,
we need to approve that then.
yeah, we need to go ahead,
That's where we can bill the insurance companies for.
Right.
Medicaid, yeah, and the insurance companies.
Right.
Yeah, I'd say go ahead and vote to approve that, and then before you guys leave the building, we can get that and get it signed.
Okay.
Yeah, if you would, yeah. so-
What do you call it?
The contract?
Is it
It's-
Transact RX?
Yeah, Transact RX.
I might have.
Mr. President, I'll move to approve the contract for Transact RX for the health department.
What it does, it allows us, right now they can bill Medicare, but they can't bill private insurance companies. It allows them to bill
And
those.
Medicaid, yeah.
Yeah, and Medicaid.
But you've already spoken with Debbie and you said it was okay.
Yeah.
Okay.
It's, gonna.
All right, second.
Then move to second, we approve
Yeah, you
the
weren't.
Trans RX contract. All in favor, say aye.
Aye.
Opposed, motion carried.
Do you need me to get you a copy of
If
that?
That
you
would be
would,
great
yeah.
if you could bring that back
I'll
up.
go down and see if they have a copy of it and bring it back up to you.
Thank you.
All right, thank you.
Thank you.
Then I'll be on the agenda for the 17th meeting, or?
Yes, yes.
Okay.
Making it better, get back to everything.
Thanks, Matt.
Thank you. If you have any questions in the meantime, let me know at the health department.
Can you
I can email you a copy.
email me a copy of this, just in case?
Yeah.
It looks pretty, yeah. I wrote my email on the back.
Okay.
That's it. I can't, I have terrible Thanks.
Okay, the last item on the agenda is the 2014 schedules for the payroll, holidays, additional appropriations, and claim schedule.
The only one I think you guys may not have, Kathy had sent me an email and didn't have, take one, pass that down, and that's on the payroll schedule. Beth got ready the additional schedule. Sharon got ready the claim schedule, and then Kathy did the payroll schedule and the holiday schedule, which I believe, this mirrors the state's holiday schedule. This is the same as what the state observes.
It's the same as what we've been doing.
Yeah.
Right.
Yeah,
So
yours just,
It just brings the dates to the 2014 calendar, the same thing we've been doing.
My birthday's not on here.
Huh?
My birthday's not on here.
Well, we'll see if we can add that next year.
Okay. All right.
So if you have no problem with that, I'd entertain a motion that we adopt all four.
So moved.
Second.
Then moved and second, we adopt the schedules as presented. All in favor, say aye.
Aye.
Opposed, motion carried. That includes the items on the agenda. Do we have any patrons' concerns? Don't have many patrons left.
you know how to weed them out.
If not, we need to approve the claims and the payroll.
So moved.
Second.
Been moved and second that the claims and payroll be approved. All in favor say aye.
Aye.
Opposed? Motion carried. Nothing further, nobody else wishes to speak, I'd entertain a motion for adjournment.
So moved.
Second.
Been moved and seconded, we adjourn this meeting. All in favor, say aye.
Aye.
Opposed? Motion carried.